Hi everyone, good morning guys. I hope I'm audible and visible to all of you. I'm Dr. Preeti Sharma and I'm your pathology and microbiology educator on the platform of PrepLadder. So welcome back with another last run towards the NEET PG 2024. Now we have a tentative date of March 3rd that is in front of us. So now we know that the way we function is that if we have a date in mind, we have the number of days that we are left with, automatically our efficiency, our reach towards the exam becomes 10 times more, right? So we are now going to cash on that efficiency that has increased, but we need a structured plan from starting from today till March 2nd night, that what number of days we are going to give to what subject and how are we going to incorporate 3 rounds of revision into this. So we have to make sure everything is settled. I have also received a lot of queries regarding how many MCQs to be doing, how to integrate the systems, how to cover a bulky subject like medicine. So keeping everything in mind, we are going to address that. So what I have decided is that we are going to make first a plan of 101 days, and that is going to take me 10 minutes to explain to you guys. And after that we are going to take up any other queries that you have from your end. So first 10-12 minutes I would want that you should just listen me out once, and then of course we are going to take it up further. So as I said, I've put up a 101-day plan for you, and that is going to include 3 rounds of extensive revision. But before I begin, whatever I'll be telling you, this has revision incorporated in it, okay? Two questions which a lot of students have been asking me is, number one, how to do revision. So should I be revising every day, ma'am? What should I be doing for, if I'm doing anatomy for 5 days, how should I be revising? So if for example, I'm going to give you a timetable, and in that timetable, I'm going to say anatomy you have to cover for 5 days. I have divided it into 4+1. What is 4+1? 4 days you do your notes, whether you're doing main videos, rapid revision, जो भी अभी तक पढ़ा है, whatever you have studied, you do those 4 days of notes and MCQs. And in that process, you are going to highlight all the volatile topics. I don't want you to be asking someone that please give me a list of the volatile topics. No, it doesn't work that way. Your volatile topics you will have to decide for yourself. Means what does your brain tend to forget, and that you will gather as you do questions. As I'll be doing MCQs, I'll know that okay, the upper limb is something I am probably weaker at than any other system. So that is customized list which you can't ask anyone else to make for you. So everyone, before I start with the timetable, remember every day as you're reading, you are highlighting the volatile topics and the words in your notes, or you are making a list of it on the side. So either you highlight or you're gonna make a list, which means that in the end, the extra 1 day that I'm gonna be giving you, you are going to revise that. So that is one thing which I've incorporated in the timetable for your revision. Second, many students have asked me medicine kaise padna hai? Are we going chapter wise? Are we going system wise? So on that note, I'll be answering that with the help of this timetable. So this, I had given you a timetable earlier on Telegram also, but many students had missed out on it. So this is your last. After this, I won't be giving you new timetables because it's way too late now. You have to start as it is, and you're starting from today. So what am I giving you today? If you're already studying, then please start this timetable from today. If you're not studying, then please, number one, declutter. If you're still in the hangover of INI-CET, please declutter your mind, your desk, your room, your study table, and give a baseline grand test today. This baseline grand test is not to give you into a mode, get you into a mode of depression. It's not to assess your score. It is just a baseline so that from here you can know what are your weaker subjects, what are your subjects which are your strength. This is what you do today. Get everything ready, and this is what you start from tomorrow. So now you'll ask me why 5 days for anatomy, because if you've given INI-CET, you've done your revisions, you've done your subjects. Now it's revision time faster. So again, I've written 4. 4 means you have to finish it in 4 days. Wherever I have written a +1, that +1 day is going to be the day for revision. So that is what you do. And I've told you how to, for those who are joining in now, you know how to revise. While doing the subject, highlight the volatile topics. That 1 day of revision is going to be revision of all the volatile highlighted topics that you have. Jo list banaya tha, that you have to revise in the next 12 to 14 hours on that volatile day. Okay? So +1 day ka matlab hai volatile day from today. From now onwards, we'll call it our volatile day from going forward. After that, a short subject. For every short subject, I am giving you, you can take 2 days, but I believe that whenever you have 2 days for a short subject, you are kind of procrastinating, kind of sleeping. You can finish it in one day if you're going in for the rapid revision. So one day for that is definitely there. Then we are back to another volatile subject. 3 days for biochemistry. Same guys. पहले biochemistry rapid revision को 2 days में you finish, and then what is that +1? That +1 is, I'll write a V. +1 मतलब जो volatile mark करा है, you are going to revise that in one day. So biochem, subjects like anatomy, subjects like biochem, they need repeated revisions, and that is the query that I'm getting from students, that ma'am, how should I incorporate? You have to incorporate your revision alongside the subject revision. So once you are done with it, you are going to revise this on that +1 day. After that, I've given you 2 days for ENT, which I believe good enough. 2 days are more than enough for ENT. One day again back to a short subject like psychiatry, which gets you approx 3 to 5 questions. So one day for rapid revision of psychiatry is there. Then we come to 4 days of pathology, which again I have divided. I hope you are good with the subject because I take it personally when we come here. So 3 days for pathology is over here, plus one day is whatever you've revised and you feel that wo jo volatile topics highlight kare the, that +1 day is for that volatile topic. After that, I think you need a break because pathology and derma are very correlated. I've kept them together. I've given you one day for your dermatology rapid revision. More than enough. One day matlab I hope by now everyone is putting in that 10 to 12 hour minimum streak. If suddenly it gave you a mini heart attack that I'm telling you to study for 10 to 12 hours, in case you're not doing that, it is time that you start doing that. You have a 100-day plan in mind. You have to give it not your best, but more than your best, because you don't want to be in the same sad mood that you were after INI-CET. You want to be in a better position. You want to be in a happier position. So if you're thinking of the other side where you want to be happier, you're giving at least 10 to 12 hours of study, effective study, not just sitting at a place, effective study. Now we come to 4 days of micro, which again, one of the volatile things. So you finish it off in 3 days, and then +1 day I have kept micro mein, to ma'am 1 day bhi kam hai, volatile every, full micro is only volatile. That is why I've given you a total of 4 days. Next we come to a short subject again. So I've kind of alternated, one big, one short. So 1 day for anesthesia. Anyway, micro के बाद हमें भी anesthesia हो ही जाता है. We are anesthetized, so might as well study anesthesia for 1 day after that. Then we come to 4 days of another anesthetizing subject, that is PSM, where I've not given you any volatile day because I believe entire PSM is volatile. You don't need an additional day. तो जो आज पढ़ोगे वो कल revise. So you are going to revise alongside. You can't say that, ma'am, I have made a list of volatile topics in PSM. Then you are making a list of the entire PARC textbook, right? So every day you read. Today you read for 10 hours. Tomorrow you first revise for 1 hour. Then you read the next part. Then third day you revise. Then you read the next part. So PSM revision goes every day. Okay, then you've got 5 days for surgery, which is again 4 days of your main jo bhi padna hai, notes, MCQs and etc. And 1 day is gonna be that volatile added. 1 day, then I think it's high time surgery and radio are integrated, right? So I've kept subjects in a manner ke integration साथ साथ हो रहा है. Surgery पढ़ लिया, then radiology within 1 day will become very, very easy to cover up and it will be integrated alongside. Okay, then you come to, if you've done radio, then again you integrate it with gynae. So 4 days of gynae with that one additional day that you've got for your volatile topics. Revision is happening side by side. I hope the timetable is making sense to you, that the number of days that have been given are strategically placed, that volatile topics ho rahe hain. 2 days we have for ophthal, good enough, not more needed than that. And I think if you do ophthal from rapid revision and QBank, we are settled anyway. 1 day for chota subject, that is forensic medicine. 2 days we've kept for pediatrics. 4 days we've kept for mega pharmacology, which means again volatile wala hai, to 3 days of revision, 1 day for volatile topics that you have to revise. That is again something settled. Then we've kept 2 days for physiology. Physio I've kept in the end because if you've read everything up till now, physiology then means few graphs and charts extra and this is going to be pretty much settled. Everyone, are you okay with this timetable up till now? Because now I will be addressing that, okay, these were your volatile topics which you felt कि मैम बार बार भूलते, and उसके अंदर I have added all your 1 days, which means that all your revisions are happening side by side. You don't need extra revision days. ये बना हमारा 48-day plan, which means you are now going in for medicine. अब ये medicine वाला question daily, I always, if you've been in this journey with me since a long time, I have always told you medicine को every day पढ़ना है. Medicine is not 5 days of medicine, 7 days of medicine. No one can finish it like that. Even if you go for videos, you cannot finish medicine videos in 4 days, 5 days. So how do I study medicine? That is including question number 1, ma'am, should I be going chapter wise or should I be going system wise? See, if you're reading things, if you're like a fresher and if you are saying that, ma'am, this is actually the first time that I'm studying and mujhe nahi pata that what is happening. If you're in that situation, if you're fresh in your mind, then go for chapter wise. But if you're post INI-CET or you have given an attempt earlier or you finished your course, ek do baar syllabus khatam ho gaya hai, now you're truly in the revision phase, then I would suggest go system wise. Means every day, like just for example, you are going to take cardiovascular system. So you know that I have to read it from anatomy, physiology, pathology, medicine, radiology. I have these set of 7-8 subjects that I have to study. Then you can probably do the daily that I'm telling you to do 1.5 hours. Instead of only medicine, you can either take it up as medicine or you can take it up as systemic. So then you will never again ask me that, ma'am, system wise revision kab karna hai. That you are doing every day. So just imagine you start from tomorrow, say, every day 1.5 hours or even 1 hour. Trust me, even 1 hour if you give it religiously, dedicatedly, you're doing that for the next 100 days. And that means you're doing systems for 100 hours and that is more than sufficient. So remember that you are not doing medicine as 4 days, 5 days. Wo nahi karna. This is something that you are doing on a daily basis and that is like a patient. I am dealing with patients every day. Systems roz pad rahe ho, matlab every day you are in touch with the clinical side. And if you're doing systems every day, then you will never ask me, ma'am, when should I revise anatomy? When should I revise pathology? You are doing your revision every day. Does that sound logical to you? Does that make sense? That is possibly the best way to deal with this timetable. Okay, if you are in your revision phase, start doing systemic revision even 1 hour every day. You are sorted. Trust me, guys. This is your 48-day plan. This goes on till January 3rd. And this means you are that time 2 months away from your NEET PG. So I've made it exactly till then, and now starts your next set of revision, that is round 2. So I'll label this as round 2. Round 2, of course, I've not given you dates because I want dates aage piche you do as per yourself. Kaun sa subject strong hai, kaun sa subject weak hai, that you decide. But I've given you the number of days that you have to do with 2 grand tests. I've added those also. So 29 days for revision plus 2 grand tests makes it 31 days that I've given to you, and I have enlisted the number of subjects and how should you be doing it, and I've given good number of subjects. Iske andar, if you notice, usually all subjects have 2 to 3 days. Short subjects I have given 4 days, and I have still, if you feel that, ma'am, every day medicine karte na, I was not getting that confidence. I want to sit down with the subject and do it properly for 2-3 days. So I have given you a 4-day mega revision of medicine. जो भी छूट रहा था, you thought that some systems were covered, some I could not, backlog हो गया, whatever you were left with, those 4 days will give you a final wrap up to medicine or your systems, right? And finally, once you're done with this, now you are left with the last 21-22 days. This is your round 3 of revision, where again I have given you usually one. Now see, last 20 days means you get practically one day approximately per subject. 1 day, half day, itna hi bachega. And by this time, someone was asking me, when will the LRR happen? By this time, we are also going to have LRR. So for students who are asking, January and February is the LRR for NEET PG, and this is of course going to be for all 19 subjects. So this means that when you're in your last 40 days, you will also have people teaching you live on a daily basis. So then you can make this timetable, okay, that tomorrow is pathology LRR, today I should revise path and go. Then next is anatomy, 2 days I should revise anatomy and go. That is how you're gonna divide all of this, is what my planning is. But round 3 to bahut dur ki baat hai. That we'll see at that point of time. Right now, I want you to start off with this 48-day timetable and continue with this for the next 31 days. Pehle first focus on round 1 and 2 because a lot will change by the time you come to round 3. You know, you will have backlogs, you will have your strong subjects, weak subjects. A lot of things will be, clarity will come in your mind. So round 3 baad mein dekhenge. Round 1 and 2, is what you're going to settle. Yes, round 2, I know you are saying that, ma'am, it has some subjects which I have not written. Agreed. Someone had mentioned, Dr. Sahiti has mentioned, what about where is our anatomy going, where is our biochem going? That is something you are doing alongside LRRs. So this is something you are doing. That's why, did you notice in round 1, Dr. Sahiti, I gave you extra days for volatile revision. So alongside LRRs, you will be revising the volatile wala subjects. For example, anatomy ho gaya, biochem ho gaya, that you will be doing. That's why I've not kept dates, because the dates of LRR are yet to be decided. So जो dates होगा उसके आसपास you are gonna shift your LRRs accordingly, and you are gonna, no, LRR is not for 2 months, Dr. Anurag. It will be spread over 1.5 month or 1 month. Why? Because we can't bombard you with 4 sessions in one day. We don't want to do that. So if there's one session of pathology today, there will be one session of pathology tomorrow. Similarly, big subjects will have 2 sessions, shorter subjects will have 1 session. So we are going to spread it out in a way that you're studying with us every day. पहले भी तो हुआ है ना, like you had LRR for INI-CET. We did not bombard you with one mega session of path of 5 hours and then keep sitting like that and getting tortured. No, it was divided strategically into 2 hour sessions, so that you're doing apna studies also, self-study, and you're studying in live classes. So that is something that is obviously the YouTube responsibility, that they will take care of, that it's spaced out in a manner that it's not a burden on you, that you're only sitting in front of your screen and listening to end moment, because end moment you have a lot to study on your own also, right? This is the timetable. Forget everything as of now, even forget 101 days. My advice to you, if I would be in your place, I would think of very short term targets at this point of time, because if I start thinking of 101 days, it kind of gives me a panic attack. It's a very natural human tendency to feel that way. So I would have thought that, okay, let me limit myself. This seems as a very structured, with revision, with my medicine and systemic being done. So this 48-day plan seems to be the first go-to thing that we have. Now if you have Dr. Naveena, if you're following the early, see, if you've started early and you're starting with the previous timetable, then you follow that. For students who have not focused on any timetable, and many students were there who were probably waiting for INI results, or were not able to get the desired rank in INI-CET, so then they are not on, they're not on track as of now. They start from today with me. If you're following the previous schedule, Dr. Naveena, you stick to that. This means you're in a better position. You've started earlier, so don't doubt yourself. Okay. Now next question comes, LRR ka dates we will give you. For till that time, abhi FMG LRR is also gonna happen. Many students have been asking me. I'll just take up a few questions. The next question being that, ma'am, should we be doing how many PYQs and RR ka kya status hai? So for subjects, my advice is, if you've given INI-CET, if you've done your main videos and you've done your main bulky notes earlier, my advice is now focus on RR only. But if you can, if you've done earlier jo bulky subjects hai na, like a surgery or a gynae or probably anatomy, or anything that you are weak at, like yesterday a student wrote to me, ma'am, मैंने pharmacology का RR पढ़ लिया, but I am only so weak at the subject that I could not understand what was happening in the rapid revision, so how should I deal with it? When you know that your problem is that you don't know a subject, like if I am scared of pharmacology, I will say, okay, let me sit with it for 4 days, main videos dekhte hain, let's get our concepts clear and let's get that fear out of my mind. That would be my approach to the fear. I don't have to get further scared of something, I have to get over that fear. So I would get over it by finishing it off from the main videos. So my advice to you is, main videos are going to go in for subjects that you are very scared of, so we'll call them the scared subjects. And secondly, of course, it's going to be for the, if you can, surgery and OBGY, and if you are, I'm assuming people are scared of PSM, so if you can accommodate that. Okay, someone is saying anatomy seems out of range. Can we skip? No, you cannot skip. But can you do rapid revision and QBank? I've given you 4 days for anatomy. Of course, you can do RR and QBank. Why do you want to skip it? See, we don't have an option here. 19 subjects, you will probably like only 1 or 2. You're not going to like. Who likes? Like, you think anyone likes microbiology, or anyone likes a biochemistry? Anything that is cramming up, or, a lot of laborious work involved in it, no one's gonna like it. But I'm not giving you an option here that ye wale pad lo or ye wale chhod do. I am saying padna hai. You like it or you don't. You can't ignore it. You are in that sort of a situation right now. So you will have to do it. You work your way around. That, okay, anatomy is like just over my head, I cannot do it, at least I can do rapid revision and Q bank. That's the bare minimum that I can give into the exam. Maybe I won't get all 15 questions correct, but even if I get 12 13 correct, it is better than not getting anything correct or getting negative marking done. So you have to think from that point of view. Don't skip any subject. You have so many resources, you have RRs, you have LRRs, you have so many crash courses. Despite that, if you start skipping subjects, means that there is some fault in our strategy. Now we have abundance of knowledge that is going on everywhere, so might as well use it in the right direction. Okay, someone's asking, I have done one revision but not able to revise, retain anything. Very usual problem. This is not a problem in November. This is going to be Dr. XT. This is going to be a problem in March, on March 2nd also. One night before the exam, you will be saying the same question. Ma'am, I read everything thrice. I followed your timetable, but I somehow cannot revise. I can't remember. I feel I've been sitting idle since 3 months and doing nothing. That is an ongoing journey and it will happen. You forget, you revise again. You forget again, you revise again. This is a vicious loop in which you're going to be stuck. Learn to be stuck in it because there is no escaping this loop. That is, you have a limited memory, you will forget things and you will learn them again. But you should have that attitude that, okay, I'm forgetting, doesn't mean I leave it. I'm forgetting means I'm going to come back to it. That determination is what I'm asking from all of you. भूलोगे एंड वापस पढ़ोगे, फिर से भूलोगे, that journey I cannot, no one can take that away from you. That has happened to every student, that has happened to every topper also. So trust me, each one of us has gone through the same journey, but who got through on the other side were people who did not take it to heart and did not stop studying. Consistent people got through to the other side is what I want all of you to know. Okay, Dr. Anurag is asking, if you've done first revision of 10 subjects, should I start fresh or continue with 11 subjects? Finish off things that are pending. Dr. Anurag, I'll be very honest. Abhi you are, obviously you're anxious, but you're little less anxious than what you will be in the month of Jan and Feb. So whatever you can finish off in this year, 2023, means you're doing that with the lesser amount of anxiety and panic, because comes January 1st, 24, you start counting, acha, 2 months are left, February anyway has less number of days. So when that kind of panic starts coming up, then your doing fresh things ability totally goes down into negative. Whatever fresh subjects you're left with, please pehle wo khatam karo starting today only, and then of course you get on with your revision cycle. Okay, daily targets medico notes Dr. Path ke liye, till mid December it will be going. Okay, rapid revision, Dr. Shakti, my advice is rapid revision. For main videos, you can go for lengthy subjects like surgery, OBGY, and anything that you are personally scared of, or whatever GTs may you're getting wrong, like a pharmac or a biochem or a micro, whatever you feel is your weaker subject, that you do from main videos. Okay. Right. Getting a lot of minus. Dr. Whitecoat is asking, you're getting minus marking in grand test. You're probably going a little more aggressive than, that tukka factor is working a lot. Now, whenever you're getting a minus going forward, figure out why did you get a minus in that. Are you just randomly making guesses? Are you making silly mistakes? Are you getting the fact ratta questions wrong, or are you getting the concept questions wrong? Because if you're getting the fact questions wrong, means that simple, there's everyone, I never take a session on how to analyze GT because I feel it doesn't need a session. Grand test mein you don't have to look at your marks. You have to look at negative, kahan aaya, kya nahi aata tha, incorrects. So my incorrect assessment is only 2. There's no rocket science behind a grand test analysis, guys. Incorrect kyun hua? Fact based question hua, this means I have a memory problem. Mujhe yaad nahi hai. Means I have to revise my notes. If a fact-based question is wrong, I revise my notes. If I'm getting concepts wrong or I'm getting clinical questions wrong, means I am not practicing enough MCQs. I know the fact, I know the logic, but when I apply that logic, I falter. This means I start practicing more of MCQs. How difficult is this grand test analysis? I've never understood why does this need a query, because it's as simple and we've complicated it as much as possible. Fact galat hai, revise karo, memory build karo. Concept, clinical aspect galat hai, train your mind and start answering more MCQs. As simple as that. Okay, so I hope Dr. Anurag and others who are having grand test related questions, this is the only analysis of a GT that you have to do. Nothing else, trust me. Okay, RR, MCQs, PYQs, LRRs, Dr. Videos and Reels. Of course, it is more than enough. You have to focus on this. I can also tell you that, see, enough will never be anything. You will obviously, I can never say that main videos are not needed. Rapid revision is all that you need. I mean, if that was all that was needed, why did we as faculties also sit and record 70, 80 hours and put in that much of effort? Of course, that is the gold standard. But I also understand with 100 days in hand, you can't revise 70 hours path, 100 hours medicine, and so on and so forth. It's impossible to revise so much of information in this much of time. You can do that in 1 year, you can't do that in 2 months. That is not possible. So that is when rapid revision comes to your rescue. So yes, the best possible option right now is rapid revision, not alone with QBank. QBank, RR ka QBank and PYQs. You have to study, only then you are making a complete package. Okay, reading revision is, Dr. Suraj, you've attended the video lectures and then you're reading the notes. Means that when you're attending video lectures, you are also highlighting side by side. So अब जब next time पढ़ोगे, you are only reading the headings and the main bullet points. You're not reading it like a story or a paragraph. You've done that when you were doing the revision of the video lectures, right? Video lectures के साथ you read everything, but you should also underline alongside that, okay, these are the final points. Next time I don't read the paragraph, next time I only read these points and I'll get the concept. Okay, LRR FMG be useful? See, it's a very personal thing. Dr. SM has asked that, ma'am, NEET PG, for those who've joined in late, NEET PG ka to LRR will happen in Jan Feb, hai na? And FMG ka LRR is happening abhi. For those who are not aware, FMG ka LRR is starting on 23rd of November. I am only starting it. 23rd and 24th of November, we are starting it with pathology only. So let's start with the subject that possibly we, I hope, fingers crossed, possibly we like. I hope so, hai na? So if I would have been in your place, I would have attended it. Why? Because एक तो then FMG PYQs I don't have to see. NEET PG I always say you should do at least 2-3 years of FMG PYQs and go as well, because topics overlap होते हैं. So I won't have to look at any other textbook. I will not have to look at any other source that where should I do FMG PYQs from. So I would have been in your place. I would have done the FMG LRR and just as a passive learning. कोई ऐसे बैठ के रट्टा नहीं लगाना. I don't have to ask for PDS, run around for anything. Schedule will be there 2x की speed पे. I would have gone through it, because that way is my FMG portion. I will not have to give any extra time, and I am again one round of revision of LRRs I do till December, and then one round of LRRs I do when the main NEET PG ka LRR starts. So I would have done that. But again, you can also customize, like 19 subjects may say some subjects, like say shorter subjects you can directly do with NEET PG LRR. Longer lengthy subjects where you need more coverage of topics, where you need multiple revisions, volatile topics का revision, तो उसका FMG LRR भी कर लेना. And वो बस सुनना, मतलब story telling होता है ना, like you're listening to a nice movie or a story or a podcast. FMG LRRs को वैसे सुनना for NEET PG. But when you come to your main NEET PG LRR, that is gonna be your mainstay for the exam. Right? Okay. What else? The second plan after 48 days, Dr. Roy, I'll give you a brief once again. It is a very simple plan where first you finish off your mega medicine, then you don't go for 1 hour वाला. एक बार पूरा जो पढ़ा है तब तक पहले वो खत्म करो. Then you within 3 days you do ENT opthal. Ideally ENT opthal by now should be half day. I've given you extra days because by this time I am also expecting that LRRs will start and you will have to include your volatile topics. That is why I've given some extra days and I've put a star over here. Then you've given 4 days for all these short subjects: psyche, radio, ortho, anesthesia, forensic skin. Matlab approximately half day, half or 3/4 of a day per subject for RR is what you're gonna give. 1 day you've given to physiology. 3 days for PSM again is more for this time. You can do in 2 days, but why have I given these +1 extra days over here? Because I am expecting the LRRs to start by then. So you will need that thoda sa extra time to finish off the videos also, the PDFs also. Rose ka 2 hours will go in that. That's why I'm giving you some extra days. Then you have 2 days for pharmac, 2 days for pedia, 3 for surgery, 3 for gynae, 2 each for path and micro, right? And for those who are asking where is our anatomy biochem, that I've told you, वो volatile topics है, जब उनका 2 sessions होगा for LRR, so do that alongside LRR, right? Next question, how many past papers? Very good question. Another one which I believe always comes. PYQs, NEET PG के लिए, NEET के लिए 5 years, FMG के लिए 3 years, and INI तो you guys have given only right now, तो what will you do? वो तो आता ही है, पता था, you've attended the recall sessions. But NEET PG 5, FMG 3 is my advice to you. right? I hope, Dr. Roy, your question is sorted. And INI, for example, treatment of typhus, will it be the same? Okay. Dr. Anurag, see, two bodies, different bodies conducting the exam, INI alag hai, NEET alag hai. But if you're asking me that, ma'am, will I always get an option where two answers I will eliminate easily, I will be stuck in the last two? Kya wo situation hamesha rahega? Yes. Any exam, even FMG, NEET, INI, that situation remains. Only the difficulty level changes. But close two options will always be the situation, and that practice you have to start. How do you do that? You do that from today when you start your grand test. I told you everyone's giving a baseline grand test today. That means that when you sit down with your grand test today, don't see कि अच्छा ये जो चार options हैं बस ठीक वाला ढूंढ लो. Also start analyzing, why are these not the options? How did I rule them out? Explanation क्यों पढ़ते हो? Why do you read explanation? Is to understand why were the other three not the answers. Because in medical profession, sometimes all four seem to be correct answers. You have to pick up the single best answer, single best investigation of choice, single best drug of choice, treatment of choice. So single best answer पहुंचने के लिए you have to know the art of ruling this out. See, every answer has an art. Like in your subjective exams, your university exams, who used to get more marks? It was never the student in the class who had studied a lot. It was always the student in the class who knew how to write the paper correctly. Answer कैसे लिखना है, colorful pens कैसे use करने हैं. Obviously, he or she had knowledge, but how did he or she write the exam also made a lot of difference. Same happens here. Only by reading notes and knowing everything will not help you crack the exam. You need to know how to apply that and attempt. The paper is also an art which you have to inculcate right now with GTs. Start giving answers by elimination, not by selection, is what I personally have done every time for any exam, and I would always tell you also to do that. Okay, micropath ke liye RR, Dr. Dharmesh, yes, it is more than enough. Will GT reflect main exam score? Same percentile in INI, Dr. Aishwarya. Don't be statistically driven. Don't come into a zone of comparison. Whatever is your GT score, you should only be comparing it with your previous GT score. You don't have to compare it with what will happen on the day of the exam. Maybe for INI your percentile matched, but maybe for another exam it won't. You cannot rely on that, and nothing's going to change also. Now, if from your previous GT you are getting better marks, you are on the right track. From your previous GT you've gone a little downhill, you need to analyze, why did I go downhill? Only compare yourself with yourself. Don't do comparison with others. Don't think of how this will reflect on the day of the exam. Everyone who's given an exam till date says जो उस दिन होता है वो उसी दिन होता है. No one can predict it. No teacher, no student, no one on this planet can predict what is gonna happen on that day. It just happens on that day, and then you have to deal with it. So don't be outcome driven, don't be statistically driven, just be hard work driven. That okay, this is my plan, this is 48 days, this is how I am spending my next 48 days, and with that determination that this was the last Diwali and this is gonna be the last New Year that I'm spending for NEET PG preparation, because next Diwali, next festival, next New Year, I'm gonna be first year resident, not celebrating festivals with family, but celebrating festivals in the ward, doing some 24-hour or night duty. That is not a very good aim in life, but trust me, students who are stuck in this cycle, they are happy with that aim also, that oh, I'll be resident first year by that time, means I'm going to be in a very settled position. I'm happy with okay, my Diwali going in the ward rather than my Diwali going in NEET PG preparation. Everyone, I think, would agree with me on that note. So that is your agenda, that this is the last New Year that I'm celebrating with myself being in this position. Next year, this is going to change and I am going to be on the other side and taking up a new journey in life. That is the outcome driven that you have to be. You don't have to be outcome driven that ye marks ko us marks se hum kaise compare kare. That is not what you have to do. Okay, Dr. Anurag, I am not asking you for whatever rank you got in INI-CET. I have not asked any student. This time I did not even put up a message asking क्या rank आया, because I know you guys start that comparison कि INI में ये rank है तो NEET PG में ये rank होगा. And then you say that INI has a rank, so this means I am doing something wrong and now I should not study. You guys have wasted. How many days have you wasted post INI-CET exam? It happened on 5th of November, and since then till date, that is 16th of November, have you successfully wasted these days by trying to study and not studying, or searching for that last ray of hope? So that last ray of hope is exactly what I've come here for. I myself will not be able to make a shorter timetable after this. Then I'll tell you to skip things. So if you want to comfortably and with a lot of dedication finish off things, this is the go-to thing that you have to do. Get over the hangover. Bhul jao. Whatever rank you got, whatever marks you got, it was a nightmare, it was a bad dream, it was a bad day. I don't want the further future to be a bad day and a bad dream. Hai na? So please, now don't focus on what happened. Please focus on what will happen or what can I do and what further can I make happen in the future. Okay. Um, TND confused what to proceed with. Dr. Sarita, see, TND versus notes. अपने notes को कभी भी मत छोड़ना is my personal advice. Whether you enroll for a TND or you enroll for any rapid revision course or anything, your notes will be by your side. Anyone who's telling me only keep doing questions and leave your notes in the last 1 month, wrong. Your notes revision has to go on till the last day itself. Okay, the timing varies. Like maybe earlier you were doing entire day of only notes. Now you divide it into 50% of the day. Half a day you do notes, half a day you do MCQs. But don't leave your notes till the end. So even if you're enrolling for any TND, notes revision mat chhodna is my advice. Okay. Don't remember anything, Dr. Devaditya. Again, a very normal problem to happen. It is, what can I say? It's not a pathological complaint that you're coming up to me with. It's a physiological condition that you're telling me that you read something and you forgot, because we always do that, and that is how our brain works. So you cannot challenge physiology of the body. What you can do is you can probably reinforce it so many number of times. So you need passive revision कर चुके हो. For those who feel that, ma'am, when I listen to you with videos on, I think I know the entire pathology and micro. But when I start doing notes on my own, I take 5 days and I feel I just don't know anything. That is because with me, you are doing passive learning. Yourself, you are doing active learning. Passive learning needs to be done only once. एक बार videos सुना and passive learning is done. Then your active learning starts, where you remember how as a kid you used to take a copy and ऐसे हाथ रखते थे, and then you used to ask yourself questions. Okay, what is the most common cause of cell injury? Then you used to ask, oh, okay, it is hypoxia. So that is how you do your active recall. Don't keep relying only on videos. It's not a good thing to do. Right? Add data. Yes, you can add data, relevant data. Only if something is a PYQ or something is high yield. Don't keep adding everything in your notes, Dr. Aryan. That would not be right. Okay, LRR for FMG, yeah, that is going to happen. I think I've told you guys the date, 23rd and 24th of November at 12 o'clock is going to be the FMG LRR for pathology, and December 3rd and 4th is going to be the microbiology LRR for FMG students. So like I said, passive learning के लिए best है for NEET PG students. ये बस ऐसे ही सुन लेना like a story, or if you feel that ma'am I wasn't studying so I just switched on your video के चलो सुन लेते हैं what others are doing in the world. So then that is the kind of approach you come, very chilled out approach you come for with with in your mind for FMG LRRs, because your extensive LRRs will happen in the month of Jan and Feb. Okay, should we do QBank now or with no QBank side by side. कोई QBank का अलग revision plan नहीं है. Whatever I have told you, this is gonna be notes plus QBank, guys. This goes side by side. There is no notes timetable and QBank timetable. सब साथ साथ चलेगा. Path, micro, everything else. Now the questions that are coming up are probably little repetitive, so I would just want कि इसको भी 2x speed पे एक बार दोबारा देख लो. So all your questions have been settled, right? Fear of failure. What about mental aspects? Mental health, more important than, I would say both are important, but still if you wanted me to select which health, mental over physical for the exam, NEET PG and INI and FMG are exams where mental health actually needs to be given more priority over anything else, and that means you are in charge of your sanity. Apna sanity kaise maintain karna hai, you decide. Means if you feel that getting off social media is good for you, do that. If you feel that no, watching social media for 30 minutes a day is good for me, that helps me be in touch with the world, then do that. Like I'll tell you personally, I never got off social media even back in the day, although I gave my exam back really long back when Facebook was the only hyped up social media. But then I was always there because I felt that was my only sanity gathering mechanism that I had in my life, right? Or going for talking to friends, or just going for a walk for 15-20 minutes, sitting with your family, whatever works for you, you need to do that and you need to customize it. So mental health के लिए यही है that you need half an hour, 45 minutes in the day where you don't talk about anything to do with NEET PG. You should just act as if NEET PG does not exist in your life. Doesn't mean that those 30 minutes maybe you are discussing NEET PG with your family or friends or on your walk or on social media. No, just stay off it. Watch random videos, watch all nonsense viral stuff like a wow that is going on, but just watch nonsense because you need something which is totally away from the studies, and that gives you that that feeling that yeah, there is an element of life that is left within you. You need to keep in charge, make yourself an in charge of your mental health. You are totally responsible for it. You don't want mental exhaustion, right? Can you start your preparation with internship? Of course, Dr. Suman. Many students are, who crack it in the first attempt are anyway preparing with internship. So you can, of course, do that. That is done. Dealing with the guilt of not getting a rank in November INI-CET. Okay, I know I can't take away that guilt from you because you worked day in and day out and the outcome has not been in your position. But since you are thinking about the future, do you want this guilt to continue after 3rd of March or do you want it to end? Now you answer that and now you know what to do. I know you have the answer in your mind. You want to remain guilty even after 3rd of March, then remain drowned in this guilt right now, I don't study. But if you want to change things in your life, then get up, change it, and of course, it's not gonna be easy. It is gonna be a journey which only I can guide you. We can all motivate you, try to talk to you, try to give you the positive aspect of it. But ultimately, it is you who is going to go through that entire journey mentally, physically, financially, in every aspect. And you are the one who's going to go through every up and down and more of downs. There are more of lows in this journey than highs. Remember this. The highs come occasionally. One grand test acha chala jayega, super amazing, and then 4 are going to crash down. That is actually how it works. The number of lows are going to be much more, and that is what you have to just keep going. Just remember, keep going. Whenever you feel give up karna hai, bas just remember what I had written over here. अच्छा ग्रैंड टेस्ट हुआ, बुरा ग्रैंड टेस्ट हुआ, याद आया, नहीं आया, योर फ्रेंड सेड समथिंग विच हर्ट यू, यू आर गोइंग थ्रू सम पर्सनल प्रॉब्लम इन लाइफ, whatever is happening, just sit with your books and just keep studying. Don't think what will happen. Just remember, I don't want to stay in this guilt after 3rd of March. I don't want my life to be this after 3rd of March. I want to be in a ward. I want to be with patients. I want to update my Instagram bio as a PG first year so and so branch. So this is the outcome that I want in my life. I don't want this guilt. I don't want this depression. I don't want to attend another strategy session with ma'am. I don't want to. I want to meet her only to tell her that, I have cleared and this is what I'm going to do with life. I don't want to ask her that how should I study next for the exam. So that is the outcome that you have to think of and just keep going, right? How to take that jump? Success stories पहले सुनना अभी बंद कर दो, right? From 1 lakh to 1K, it's obviously an amazing jump. Someone who's done that must have done something right. So success stories में ये मत सुनो ना 1 lakh to 1K कैसे आया. Listen to the success story for finding out that how did that person, what kind of mental pressure and what kind of agony that person must have gone through जब उसका 1 lakh rank आया था, but still he or she could have also drowned in that guilt, right? But that person did not. That person decided to emerge as a fighter and a winner and is now under a 1K rank. So that aspect of the success story, the struggle is what you have to look out for. That 1 lakh पे उसे कैसा लगा होगा. You guys are thinking, अच्छा wow, 1000 rank आ गया, what a lucky fellow. No, he's not lucky. He's put in his blood and sweat into getting that. And just imagine the day he or she got that 1 lakh rank. उसे guilt is just an understatement. Just imagine what that person must have felt on that day. How difficult it must have been to come out of 1 lakh and revise and practice everything again, and then just imagine the happiness on that 1K rank day. And that happiness is what has to get you going, not that 1 lakh depression that you are focusing on. Okay, RRH 2.0 batch, Dr. Rohit and others who are asking, Dr. Vivek also, that is starting November 18th. So yeah, day after tomorrow it is starting. If you want to practice that, if you feel you are more of a task driven person where someone tells me अच्छा इतना पढ़ना है तो इतना हो जाएगा, if that's the situation, suit yourself. I would never force you to follow this versus that. Whatever you feel works best for you. This is a time टाइम टू बी सेल्फिश. जो अपने लिए काम कर रहा है वो करना है, जो टाइम टेबल सूट कर रहा है वो कर रहा है. whatever source you feel is useful, you do that. So if you want to follow this timetable, most welcome. If you want to follow RRH because you want that acha app will automatically put me in that loop of today do this much and tomorrow do that much, you go in for that. Okay, clinical scenarios in LRR for FMG, clinical based, Dr. SM noted, of course we are going to do that. We are LRRs of FMG and NEET will be two things based, entirely MCQ based, because rapid revision to you guys have done na. So अब सिर्फ MCQ based वाला revision करना है, and that is exactly what I'll be focusing on. Recent updates necessary for NEET PG? Yes, Dr. Bidisha, there is a separate recent update tab that is there in the PrepLadder app, and you can refer to that. You will get the updates over there. PDF मिल जाएगा, yeah, I'll give you, although this is like practically just one slide which is there in the PDF, but I'll give that to you. What to do? RR, Dr. AD, that is what you're gonna do. RR for ANAT and Biochem, if you've never read it earlier, RR and QBank, that is how you go about it. Yeah. So I guess we are settled broadly, and I take leave, although I'll be meeting you very soon because the FMG LRRs are starting 23rd, 24th November. That is when the entire sequence and 19 subject LRRs are starting. So we'll start with pathology and let's see how our preparation goes. But I hope when I meet you next, you guys are on track and you have been pretty much into this timetable that we have put up. ठीक है. Anything else that you have, any questions that I've missed out? As I always say, put it in the comments below and I will get back to you. I'll reply to you, I'll follow this thread, and whatever you will be posting, I'll put up the answers to that in the comments below, right? Thank you so much for joining in. All the very best. You have to make it happen. Remember, good things take time, but if you are ready to invest that much of time, it's going to be a very, very different world and an altogether different outcome that you have also not probably thought of. Life is much, much better on the other side. You just have to pass these last 100+ days and get to that side once, and trust me, things are going to fall in place. Just have that confidence in yourself, in your preparation. Thank you so much for joining in, guys. See you very soon. All the very best.